Hi everyone, I'm Dr. Nguyen, and today we're going to do a demonstration on the Fraxel Restore or Fraxel Dual Laser. This is probably one of my favorite laser to use because it has such a wide indication. It has two wavelengths on it, the 1927 and also 1550. The 1927 is a more superficial wavelength. This is a resurfacing laser. So when we use the more superficial wavelengths, it really helps to target mild to moderate sun damage, brown spots, and if we really turn up the density, we can use it to even treat precancers or actinic keratosis. The deeper setting drives the heat a little deeper into the skin, so it really helps to stimulate the deeper collagen, and this will help to fix moderate to more severe sun damage. It can also help to correct lines and wrinkles as well as acne scars. So it really has a broad indication. It is a resurfacing laser, but it's not ablative, and it's also fractionated, which cuts down on the healing time and has much safer safety profile. So typically when a patient comes in for treatment, we'll have them come in about 90 minutes before the procedure. We will apply numbing cream on them for about 60 minutes. After that, patients will wash her face, and we can then proceed with the laser treatment. And typically, to protect both the operator and the patients, we have goggles on, and we'll show you the patient later on. She has eye shields on her. Typically, before the treatment, we are going to treat, our patient has the concern of round spots on her face today, so we're going to use the superficial 1927 wavelength. When I go into it, I just want to show you that there are many things that I could, adjust on this. We can adjust the energy, so going down, make it more superficial. Going deep drives it deeper. We can adjust the density or the coverage, so we're going at about 50%. And then we can break that energy up over however many passes to make it more comfortable for the patient. When you do less passes, it's more heat, so it might be more uncomfortable. My favorite go-to is to spread it over 8 passes. This also allows me to make a more uniform treatment. Now, when I say fractionated, what exactly does that mean? I'm going to show you. So usually, I will test it on our test strip here. So fractionated laser means that it lays down the heat in little microthermal zones, like little dots in a grid-like pattern. And there are normal skin in between. Now the normal skin allows for your skin to heal faster. This is why this makes this a safer laser as well. So here we are ready for treatment. And when I depress on it and do the treatment, roll it across, you can see here it lays down little dots. So where you see the black is where the skin is being heated up, and the clear area is the normal area. So you just do passes in different directions to ensure and you do 8 of this, about 80% of your skin will be resurfaced. In this case, we actually changed it to 50%, and 50% will be normal, so the healing time will be faster. So let's turn to our patient now. This is Robin. Again, her concern is brown spots, so we're going to be treating her brown spots today. I'm going to bring her up a little higher for me. And this laser also has a fan, which blows cool air at the patient. The cool air helps to keep the patient more comfortable, as well as help to cool down the skin so that it doesn't overheat. Again, which is also a safety feature. And with this treatment, patients will typically report feeling like a hot, tingly sensation. With each pass, the heat does build up, so it gets a little bit more uncomfortable. So I may ice the patient during the passes to help them kind of like get through the procedure more comfortably. All right, Robin, are you ready? Mm-hmm. Okay, so I usually go all around the face, back and forth, 8 times. So we're gonna start with the forehead. How are you feeling? Good. So it's a nice, smooth, rolling motion rather than a stamping motion, so it allows you to follow the curvature of the face really well. You can't really see it, but when you look up close, you do see those little dots on the skin. And in a minute, she may turn a little pink. Expectation after the procedure, it's going to look like a sunburn. So your skin will be pink for anywhere from 1 to 3 days. By around day 2 to 3, it's going to also look a little bronze because all of that pigment is going to come up to the surface as little pinpoint scabs. So from afar, it looks like a bronze appearance. And then after that, those will peel off by around day 4 to 5. So most people are back to somewhat their baseline by day 5. So you can see here she's a little pink. We're going to go down her nose now. And they may stay just slightly pink till day 7 or 10, but they, for the most part, can cover that up with makeup. Moisturizer, a gentle face wash are recommended during this time. Definitely you should avoid the sun. Wear sunscreen whenever you go outside, just to prevent any risk of hyperpigmentation or abnormal discoloration because of the sun hitting your skin while it's inflamed. How are you feeling, loving?
Good.
What would you say your discomfort level is?
0.
0. She has really good pain tolerance. So most patients report about, I would say, maybe a 4 by midway through the procedure. But the first pass is more comfortable. But in all my patients will go through the procedure, finish them just fine. When it's all healed up, they absolutely love the result because their skin has a nice glowing look to it. The pores look smaller, the brown spots are less apparent. And typically, depending on how aggressive we treat it, I always tell patients you're looking at about, on average, 4 treatments, whether especially if you're treating deeper wrinkles or acne scars, it could take even 6 treatments before you get to the desired outcome. So we're almost at the end of our first pass for the face. So what we're looking for is trying to have uniform redness as much as possible. So I went kind of vertically this first pass. I'm going to go horizontally now. So I do go in different directions just so that at the end of the day, it will be as even as possible. What's your pain level now on the second pass?
Maybe a 1.
Okay, so she moved up a little bit to a 1, and that's not unusual. Just because when you heat up your skin, it becomes a little bit more sensitive. So can you zoom in and see if we can see all the little spots on her skin? Basically, that's what I was talking about. The laser is just heating it up in these little microthermal zones in a grid-like pattern. But if you look closely, there are normal skin in between. And studies have shown that having that fractionated damage with normal skin really does help with the healing time. So overall, patients do really well on it. I rarely ever do see any complications. And it's kind of like my home run laser. People are, for the most part, always very happy at the end of the day. Just some considerations to make sure that if you have darker skin, to do the laser when you're not tan. So ideally during the winter months rather than the summer months. And then talk to your provider before, because for darker skin folks, there's a risk of something called hyperpigmentation with this laser. And when that happens, you can actually prevent it by doing some bleaching creams ahead of time. If you the way to know if you hyperpigment or not is if you recall, if you ever have a big pimple, if your skin does leave a little brown spot after that heals up for a few months before it goes away, that means you're at a higher risk of hyperpigmentation. So before you schedule the procedure, it may be best to talk to your provider first to talk about how to mitigate that risk. But it is possible to treat even in slightly darker skin complexion with this. So you probably get the idea when we get past through with the second pass. We'll pause the video. I will keep on going until we complete 8 passes. And then we'll put some post-procedure cream on her afterwards. And in terms of post-procedure cream, I really love the Lastin skincare line. They make a nice regenerating skin nectar that is good to use to prep your skin before the procedure and then also immediately after the procedure. It has a nice trihex peptide technology that helps the skin to boost collagen growth and also heal significantly faster. So you can really cut down your redness by a magnitude of a few days even with this. So that is not too heavy, so it's good to use twice a day. And then we also will also put like a more Vaseline thing right afterwards on the first day. Ice, gentle face wash, gentle moisturizer, and if you can splurge for it, the post-procedure treatment creams are really helpful to help to really up the effectiveness of this procedure. All right, hope you enjoyed the segment.